With millions of coronavirus cases and hundreds of thousands of deaths globally, the world continues to battle the COVID-19 pandemic. Nigeria, like many countries of the world, has continued to witness an upsurge in the number of infected persons, even as the government continues to double efforts in the fight against this pandemic. However, many have associated the rise in the spread of the infection to challenges such as ignorance on the part of and the fear of stigmatization, which has prevented many possible carriers from seeking the appropriate attention, thereby increasing their chances of infecting others.
There are several factors that could account for the continued rise in figures of people infected with coronavirus. Guidelines have been put out: wear your face mask, maintain social distancing, avoid parties and all of that. But most people, if you go out in the society, you see that people are not obeying all these instructions. The average person on the street does not believe that COVID exists. They believe it's a scam.
With COVID-19, you may not have symptoms. You can just recover fully. And many people who have had the COVID-19 and have actually been to the treatment center have been able to testify that it is not a death sentence, and nobody should stigmatize anybody who has been tested for COVID-19.
Prior to the outbreak of the pandemic in Delta State, Governor Ifeanyi Okowa and his team took several far-reaching steps in readiness to fight this deadly scourge. The level of preparedness could be seen in the upgrade of health facilities across the state, provision of well-equipped isolation and treatment centers scattered in different locations in the state, as well as provision of PPEs and the training of health workers and other frontline responders. All these, to a great extent, has helped ensure the proper care of patients as well as reduce risk of contraction for medical personnel.
We have a couple of treatment centers, holding centers, the most recent being this at the stadium. Trainings are ongoing on a regular basis, and contact tracing is very active. So clearly we are reaping the benefits of all of that.
We have set up treatment centers, isolation centers. The governor, is a medical fellow. He's been very, very proactive, and thank goodness we have not had much in terms of fatalities.
We started training of health workers for COVID-19 as early as April, far before we even had our first case. So most of us were actually prepared intellectually. The governor, being a doctor, actually helped a lot. He understood the challenges, he understood the risk factor, and he acted early.
These huge investments in health are beginning to bear fruits as the state continues to successfully manage the virus owing to already established facilities and adequately trained medical practitioners. However, as the fight against the dreaded COVID-19 continues, there remains a pressing need to rid her citizens of cynicism and doubt, which is associated with the presence of the virus and its rising numbers. To this effect, a survivor and the state's index case has been decorated as the state's maiden ambassador to pass the message that COVID-19 is real.
Thank you very much, and God bless you. This is also an appointment letter for you as the Delta State COVID-19 Ambassador, signed by the Honorable Commissioner for Health on behalf of the government of Delta State. Congratulations.
Austin Eroto, who already set up an enlightenment campaign, continues to assure Deltans with the help and support of his team that COVID-19 is real, but not a death sentence. He commended the state government and medical team for helping him on his path to smooth recovery.
When God delivers you from some of illness, you have to give testimony. By giving testimony, you are creating awareness. But while I was in the isolation center, a lot of people were saying things about COVID-19 is not real. So I was looking, I said, these people are still in the dark. So I said I should go there, take it off myself to sacrifice, to create that awareness.
Hope continues to surge as the state continues to record the recoveries and discharge of several COVID-19 patients, one of which is the recently discharged Ofure Ohifo. At exactly 1 p.m. on the 8th of June 2020, young, bold and beautiful Ofure Ohifo emerged from the state COVID-19 treatment center located at the Asaba Specialist Hospital to join the list of those who have successfully recovered from the pandemic in the state. Her discharge was laced with congratulatory cheers and applause. Ms. Ohifo attested to the hospitality of the medical team even as she spoke against stigmatization.
The doctors here are incredible. They are really friendly. They check on us all the time. You know, even at night you'll be sleeping. They don't sleep. They'll be watching us through the CCTV and they can call you and say, change your sleeping position so you don't fall. Like, they took adequate care of us. The facilities are great. I really commend Deltas. They've done a great job.
The desire to address existing prejudices and curb the spread of the virus in Delta State has propelled the state government to take advantage of the personal factual experience of some survivors to sensitize the general public.
This virus is very real. It is not a scam like most people think. Before now, I was someone that when people are talking about COVID-19, I had little or nothing to say because I didn't even understand the virus. I somehow did not even believe there was a virus or there was a pandemic. But having tested positive, I now know that it is for real and there is actually a virus, COVID-19.
We take pride in effort at sensitizing our people because we believe that prevention is far better than cure. For those who have prejudices, who continue to think that COVID-19 is not real, you heard the young lady that was discharged here in Delta. We don't want others to just see before they believe. We want them to believe on time so that they can also assist us in curbing the spread.
Smart Delta. Ofure further spoke to Smart Delta media team about her post-recovery experience.
My family is quite small. 3 children, 1 mother, 1 father. Unfortunately or fortunately, 4 out of the 5 of us were affected. The 5th person was not affected because he doesn't live with us. When me and my mom left there, when we got home, we were talking and we said the same thing. We were missing the place. I mean, who misses a hospital? But we literally missed the place and the people that we met there.
So while I was in the hospital...
Jerry Azinge is another COVID-19 survivor whose case was equally successfully handled by the medical team in the state. He has made himself an advocate of the reality of the COVID-19 pandemic in the state.
I must commend His Excellency, the Governor of Delta State, for putting in place a fantastic medical team and medical machinery to handle the incidence of COVID-19. I was hospitalized at the Federal Medical Center, Asaba. I was treated to first-class medical care. The isolation center, it is of world standard. And while I was there for 18 days, I felt that I was on medical vacation.
Jerry Azinge Esquire further reiterates the testimonies of Ofure while also speaking against stigmatization.
I tested positive, I was hospitalized and treated, and I'm now out of it. I don't think there is any need to stigmatize anybody. It is not a disease that is gotten out of immorality. So there is no need for stigmatization. It should end.
Sharing stories such as these ones have continued to reverberate in the state and have further strengthened the sensitization drive of the state government.
Let me use this medium to thank our governor for his strive towards this COVID-19 program. The manner he take about this whole program. Begin to realize that, see with my eyes that those that have treated, they have recovered from it. So that makes the whole tension that anybody that have this COVID-19 will die with it. But that have changed our narrative that is curable.
Our governor try. When we say people when you get them, they don't cure. He come off here for people mind say corona self. If you get yourself, you go see get cure.
There is not a lot to merry about in this period, but health workers certainly have a reason to smile as the Delta State government has taken initiative to compensate and reward medical practitioners for their daily sacrifice by providing allowances for those in the line of duty. The state government has also initiated life and health insurance policy for no fewer than 2,557 health workers.
I want to use this opportunity to thank all our health staff for the great work, the great commitment, because they are in the line of duty to help each and every one of us and for the good of each and every one of us. I want to reassure both our health staff and the auxiliary staff that they will be adequately remunerated in the course of their duty.
The state has also taken life insurance for 2,557 health workers to motivate them. And I wish to commend our health workers for their selfless efforts, untiring efforts so far. I urge Deltans to please continue to pray for them.
Speaking with Smart Delta recently, Dr. Anne Ojimba, a medical practitioner who heads the state COVID-19 case management, and some of our colleagues explained that the efforts and initiatives of the state government motivate and serve as a driving force for health workers in the state to discharge their duties with due diligence.
The work we do, nobody can pay anybody for this kind of work. But the fact that the state government is getting for us health insurance, which has already been done, they pay a monthly stipend for all cadre, including cleaners, those environmental health officers, even those in the field at the local government level. The state government is giving stipend. That is a lot of motivation for healthcare workers.
With these incentives, health insurance for the health workers is also going to motivate us. Whatsoever happens, we could fall back to something.
I'd like to use this opportunity to let everybody out there know that COVID-19 is not a death sentence and it is not contacted through any sexual act. So nobody needs to be stigmatized for having COVID-19.
My name is Ofre Okifo and I'm a COVID-19 survivor. COVID-19 is real, but it is not a death sentence. It is easily contractable. Please follow all the preventive measures and stop stigmatization.
I tested positive, I was hospitalized and treated, and I'm now out of it. I don't think there is any need to stigmatize anybody. It is not a disease that is gotten out of immorality. So there is no need for stigmatization. It should end.
The coronavirus is not a death sentence.
Let's end stigmatization.
End stigmatization.
End stigmatization in Delta, Nigeria.
End it in the world.
Partnership has indeed proven to be one of the strongest allies in the fight against the novel coronavirus. The Delta State government, in collaboration with Irua Specialist Hospital and Pan-African Network for Disease Outbreak Research and Rapid Response, Pandora, have been able to achieve milestones in her fight against the spread of coronavirus with the establishment of a laboratory for the testing of the disease in Asaba. This achievement has enabled the state to scale up the COVID-19 testing, as recently seen in the upsurge of confirmed cases.
This lab, as it's configured, can actually serve many states in the country because it had capacity to, at a go, 23 samples at once. And that's the procedure will last for, say, 5 to 6 hours. So if you work, let's say, twice a day, you'll be able to test up to about 46 samples, and the results will be out that same day.
The fact that we are testing here now means that we can test more persons, we can get our results faster, and we don't have to put people at risk of traveling from here to Edo State, Irua, to send samples. And of course, we also know that in the process of transportation, something could happen to these samples.
There is no gainsaying that the governor's commitment and proactiveness in the fight against the spread of COVID-19 has endeared several firms and bodies to extend support to the state government. Recently, a 100-bed space holding center, which doubles as a treatment center at Iseluku, was inaugurated in synergy with Kakovid, Zenith Bank and the NYSC. The secretary to the state government, Chiduebie, in his speech expressed the state's gratitude for their contribution and support towards the fight.
I would like to thank the private sector coalition for COVID-19 for all that they've done, not just here, Isolation Center alone, but all the other support that they've given us as a state government.
Subsequently, in the oil and gas industry, Chevron Nigeria Limited, MPDC, and Heritage Oil have all in their various capacities supported the government by donating medical equipment like ambulance, infrared thermometers, COVID-19 testing kits, ventilators, and other medical consumables to boost the fight against the spread of the virus in the state.
On behalf of Heritage Energy Operational Services, we want to present this to the Delta State government.
We are presenting the medical PPEs in view of what we have realized the doctors and other medical professionals are doing in this field, especially in this fight towards eliminate COVID-19. In view of these contributions that they make, we should make our own donations on behalf of MPDC and management to Delta State government.
They are sending this thing to boost and support the Delta State government. This will go a long way cushioning the effect of COVID-19.
As Delta State government continues to intensify its efforts to tackle various health challenges, it has therefore become pertinent to rid her citizens of any form of disbelief, negligence, and misgivings, especially those associated with COVID-19. Thus, the need to set the state on a prevention course through series of enlightenment campaigns and sensitization to manage the spread of the virus. A team of Smart Delta reporters regularly follow series of these government campaigns to bring to you sights and sounds of government's fight against a common enemy.
As this park be so, una suppose get buckets where they run, where get tap under. Then una go put soap. Any passenger wey come before you go enter motor, you go find wash your hand.
As the saying goes, knowledge is power. And right here at the Efurun roundabout Warri, we are witnessing one of a series of the sensitization campaigns that are ongoing in Delta State, which is geared towards educating the people about the new coronavirus disease to help reduce the spread and maintain a healthy populace.
The way they show how to use, so that how to wash our hands, how to do everything, how to stay 1, 2, 2 for motor, we like them. Governor Ifeanyi Okowa, I say make you try, make you help the Delta State like this continuously.
What the government can do for our park this morning, they make us happy. We really know say government care about us.
This sensitization drive, which has been taken to the grassroots, rural areas and settlements, have come to the public eye. One of such communities is the Arewa community, comprising basically the Hausa Fulani group. A 10-man committee saddled with the responsibility of sensitizing the community has been up and doing.
When the state government came up with this committee, they now ask our people to train others. Those people are going almost house to house, group to group, inside the mosques to gather people to sensitize them. So we really thank the government. The governor is one of the best governors we have in this country.
Each local government will have 12 members, and our mission to make sure that let our community be awareness of this sickness.
We have been walking around telling people on how to take care of themselves.
Smart Delta media team met with Mr. Issa Mohammed and other prominent members of the 10-man COVID-19 sensitization committee at Uye, Warri, and Varon. According to them, this initiative of the state government towards their people in the state is a pointer to the benevolence of the government to citizens and all residents of Delta.
The essence of this exercise is nothing but to reduce the spread of COVID-19 in the Delta State at large, most especially in the Arewa communities, because our people are so much fond of I don't care attitude. It's our task to make sure we educate them for them to understand. With that, it will reduce the spread of this coronavirus in the state.
We are happy for the Delta State government to remember us and include our community in this program. It is very important for us to follow the guideline and instruction that the state government have laid for us.
We really appreciate the executive governor of Delta State to be remembering us to set a committee which is will come around to make sure that our people be a part of the beneficiary of awareness of this COVID-19, because we know it's a man who has always carried everybody along.
After a brief meeting at the office of the Seriki of Uye, The team set out and arrived at a scrap yard donated by the Arewa people, and of course, Smart Delta media team was present to capture the process of sensitization every step of the way, and did not hesitate to sample the opinions of some of the beneficiaries of the sensitization.
They meet us community by community. They are telling us to make sure we cover our mouth and the nose, and we should be looking for soap and some other chemical to make sure we always washing our hands. We thank the state government.
I'm very happy for the Okoa government. I pray for the Okoa now, so because of this one we just do it. So I'm very happy for that.
While the importance of sensitization was increasingly acknowledged by the sensitization committee members, they explained that this is equally an injunction of the Holy Quran.
Islamically, we believe there are some sickness that can come in the community that don't have cure at that particular moment. Is in the Quran. Yes, we call it An-Noba. So when An-Noba comes in, what our prophet advises us is we should chuck in and listen to people to educate us. And once they educate us, we should respect what they say to us and go according to what they teaches us in order to avoid the sickness to come in, because what affects you affects others.
Just like in the Arewa communities, it is pertinent to note that other forms of enlightenment campaigns on COVID-19 are currently ongoing in the state. Moving around, one could easily spot flyers, billboards and notes that bear tales after this fact.
I have seen signboard in many places, like this market. I've seen signboard along the street. By people seeing the signboard, they will know what to do.
The billboards when they see, it don't teach me many things. At least to use your alcohol-based sanitizer, to wash your hand regularly, wearing a face mask. At least it's helping.
As sensitization is to knowledge and awareness, so is monitoring to adherence and compliance. As part of the continuous monitoring of COVID-19 health protocols by the Delta State Government, the task force, headed by Chiduebie, Secretary to the State Government, set out on yet another routine visit to business premises and corporate offices to ascertain the level of compliance in living the new normal as stipulated by NCDC and adopted by the state government. This is what they found.
Look at the number of people in this small place. So you can tell the difference between right and wrong, good and bad. You don't even know whether it's a staff that may be asymptomatic. You don't know whether it's another person. But to you, it doesn't matter, because as far as you're concerned, it's a joke. But it's not a joke to us. We have a duty to protect people. We have a duty to ensure that what either Mr. President says or the governor says is done. If you don't want to do it, then we will enforce it and treat you in a way that you may not like.
The fight against coronavirus is far from over, as cases of COVID-19 are currently still on the rise in the state. However, the Delta State government is not deterred in its fight against the virus. Over the past few weeks, the Delta State government has shown resilience and commitment in fulfilling its promise to not just keeping Deltans and all residents in Delta safe, but in good health.
The feedback segment. Question of the day.
I want to ask the Delta State government to look at a scenario whereby someone is wearing masks and you begin to feel airtight. You are gasping for breath because the air is not sufficient as normal. What do you do in that kind of scenario?
Thank you, Tonia Terisheju, for that great question. And I want to say that COVID-19, it's usually more fatal in patients who have underlying diseases that affect the lungs. Yes, there's a law that says that you have to wear your face mask. And it is also very protective for you to wear a face mask to go outside in public places.
It's important to get informed about what is going on in this state. If you're going to pass suggestions to us as government, your suggestions will be welcome. To know more about the Smart Delta team, follow Smart Delta on their various links.
Text your questions to 09016652274 or send with the hashtag #AskIt to all our social media platforms.
You better run, come
come to Delta State. Come and see the good things where Okowa they do you better. Run, come to Delta State. Come and see the good things where Okowa they do. I see a job and work creation in Delta, make the youth say them higher. Okowa. I see good roads everywhere in Delta, make the people say them cola. Come live in Delta. Say me I say. Come invest in Delta. Come explore the potentials of our state.